I will now begin my examination of skin, hair, and nails. First, I'll sanitize my hands. Okay, first, I will inspect the skin, noting its color, general pigmentation. Is it hyper or hypopigmentated? I'll be looking for anything suspicious, like lesions, bruising, or vascularity. Let me have you stand up. Turn around. I'll be looking for any moles or anything that looks suspicious. Okay, thanks. Turn around. Have a seat. If I see anything suspicious, like a mole or a lesion, I would use the ABC acronym to note if it's asymmetric. I would look to see if the borders are regular. I would note its color, the diameter, and its elevation. Is it raised above the skin? Next, I'll palpate the skin, noting its temperature. Is it dry? His skin is dry. It could be warm, hot, or cold to the touch. Is it moist? Is it clammy? Is he diaphoretic? And that's a no. Next, I'll note its turgor and its skin thickness, noting for any swelling or any edema. Next, I'll pinch his skin, noting the turgor. If it stays up, it's called tenting, and it may indicate dehydration. Also at this time, I'll be looking at his skin's mobility and noting his general hygiene and if any teaching is necessary. Next, I'll examine his hair. First, I'll look at his hair, noting its color, its distribution. Is it normal? Next, I'll palpate, feeling and looking for any lesions or anything suspicious on his scalp. Next, I'll examine his nails. First, I'll look at them, see if they're dusky, pink, if the bases are separated, the nail bases are separated. They're not. Next, I'll check his capillary refill and see if it's less than 3 seconds. And it is. Then I'll palpate, see if it's dry, see how it feels. I'll be looking for any clubbing on the fingernails. If I had a ruler, I would measure, and the degree should be less than 165 degrees would be normal. Anything greater than 185 degrees would mean clubbing, which could possibly be a respiratory disease. But without a ruler, I'm going to use the shaman's rule, and that's where you put 2 fingers together like this and the nails together, and in between there you see an opening or a hole like a diamond pattern. That means it's normal and I don't have any clubbing. And if you look here, he does not have any clubbing. Next, I will teach the patient how to do a self-skin examination to look for anything abnormal, to stand in front of the mirror, look at your palms, back of your hands. Full-length mirror would be preferable. Back of your elbows, your arms. Stand with your back in a handheld mirror, examine your back, your hair. When you have a seat, look at your inner thighs and the soles of your feet. This concludes my nursing skills assessment for skin, hair, and nails.